Hello and welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. According to the World Health Organization census statistics, mortality due to cardiac causes has overtaken mortality caused by all cancers put together. According to the WHO, approximately 4,280 out of every 1 lakh people die every year from sudden cardiac arrest in India alone. The concerning changes in recent times is the onset of heart disease is now seen at a younger age, especially in people who are just in their 30s and 40s. The biggest reason for heart-related deaths is a lack of awareness as to what needs to be done in a cardiac emergency. Life-saving techniques such as CPR give you the power to save a life. It has been proven that bystander CPR improves the rate of survival by almost 50%. It's even more important if you have a loved one who has a history of cardiac disease, as research reports that the majority of cardiac arrests occur at home. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. Girish Navasundi, a senior consultant and interventional cardiologist, director, Cath Lab, Apollo Hospitals, Bengaluru. Dr. Rahul Patil, senior interventional cardiologist, head premature heart disease division, Jaydev Institute of Cardiovascular Sciences, Bengaluru. And Dr. Tirumala Naresh Arava, consultant interventional cardiologist, Vaishnavi Super Speciality Hospital, Guntur. Thank you so much, doctors, for joining us on this program. And Dr. Navasundi, first to you, heart failure is a global pandemic. Its prevalence is increasing day by day. So what is heart failure, and if not treated on time, what problems does it cause?
Thank you, Ms. Gargi. As you appropriately said, I think the global pandemic at this point actually is heart failure, not the infectious disease. And as the populations age and live with risk factors such as hypertension, diabetes, and structural heart disease and heart attacks, the prevalence is only going to increase. What is heart failure? It's a condition where heart is unable to move blood forward to meet the demands of the body, where a person can become tired, fatigued, breathless, or disabled to do his routine activities. If not identified, this is associated with highest risk of death rate among all the diseases known to mankind. The death in those patients with heart failure and reduced pumping capacity is much higher than in most of the cancers. So that is the gravity of this problem. So it's very important that we identify the prevalence as well as the occurrence of symptoms very early in the people with suspected heart failure. It has two components. One, educate people about the symptoms of heart failure. Second, have them periodically checked, even in apparently healthy people, to know if they have structural heart disease which may predispose for heart failure in the coming days. That is the need of the hour, Ms. Gargi.
Right. Dr. Patil, what are the risk factors for heart failure, and what are the pre-existing conditions that may increase the risk of heart failure?
Yeah, that's a good question. Basically, the more common and important causes of heart failure are actually the pre-existing heart disease conditions. Like, for instance, a person who's had a recent episode of heart attack, which could have caused significant damage to heart muscle, because of which his heart is not able to pump blood sufficiently. That could be one of the pre-existing conditions. Then there are other cardiac conditions like an untreated congenital heart disease, or a heart disease which is acquired since birth, or certain untreated valvular heart disease could be the precipitating factors for a heart failure. Then also there can be certain genetic or familial conditions which might cause heart failure. So this talks about the heart disease aspect of it. Then there can be certain systemic diseases, like for instance a kidney failure patient, a liver failure patient also is prone to a heart failure conditions. Now coming to the more subtle aspect of it. So it does not always mean that a pre-existing disease condition patient is the only person who is predisposed to heart failure, because age more than 65 years itself is a risk factor for heart failure. uncontrolled diabetes, uncontrolled hypertension, along with certain lifestyle habit conditions like chronic smoking, alcohol consumption, and physical inactivity. So these are also risk factors for heart failure. So all in all, this covers two aspects of it. There is one wherein we have a pre-existing disease condition where the treatment and the compliance aspect of it becomes important. And secondly, there is a condition where a person is he appears to be normal, but he might have certain risk factors like uncontrolled diabetes, hypertension, or physical inactivity, or smoking or alcohol intoxication. So these could also be risk factors for heart failure.
Right, Dr. Rava, for us Indians particularly, cause of concern in diseases are early age of onset, rapid progression, and then high mortality rate. Why is this?
Yes, our Indian population is getting CAD earlier compared to other demographics. Average age of onset of CAD in our Indian population is around 53 years, and it is 5 to 10 years earlier compared to the other demographics. It is because of genetically Indians are more prone to develop coronary artery disease, and there is also increased risk factors like smoking and low physical activity, increased incidence of diabetes and high cholesterol levels. These all leads to the early onset of coronary artery disease in our population. And after getting the heart disease, there is a lack of awareness and knowledge and delay in the treatment. This all leads to the rapid progression and mortality and morbidity. In coronary artery disease, once with onset of heart attack, initial 12 hours we call it as golden hour. As early as patient get the treatment in initial 12 hours, as early as possible, less will the complications and he get benefit and mortality and morbidity also very less. Another important point is compliance to the drugs. Once we diagnosed with heart disease, and drug compliance is very important. Most of the patients do not maintain compliance, and uncompliant patients generally will progress and develop more complications and more mortality and morbidity in non-compliant patients.
Right, Dr. Navasundi, can heart failure occur without knowing it? What are the signs of worsening heart failure?
Yes, unfortunately, being a very serious illness, it starts very silently. Most people do not recognize the early symptoms. The common and salient features of heart failure are easy tiredness, breathing difficulty, inability to do the amount and extent of activity they were doing earlier with comfort. They may find it more difficult. Next, they could develop swelling of the feet, legs, or distension of the abdomen. Lastly, it could also appear like an asthma where they just have wheezing. Few of them even could have giddiness or palpitations, heart beating fast, and at times sudden unconsciousness. Why does this happen and why people don't recognize it very early? The disease is more prevalent as one ages gracefully. About 10% of the adults beyond the age of 60 can have heart failure. And most of these people think that these symptoms are due to aging. They don't attribute it to a disease, but they think because I'm aging, I'm unable to do, and this breathlessness, tiredness, swelling could be due to my aging. That's how they get neglected. And what is the cost the community pays? The later the disease is diagnosed, there could be irreversible reduction in the heart's capacity, which may not be recoverable. Secondly, there is huge economic burden due to hospitalization and symptomatic improvement without correcting the disease per se. And lastly, if it is left undiagnosed, the risk of sudden death is almost 5 times more among these patients compared to the common people. So it's very essential to identify symptom by the people and having preventive education among the physician, even general physicians, to proactively look for presence of heart failure even in asymptomatic patients, means people who don't have symptoms. Thank you.
Right, Dr. Patil, early and on-time diagnosing of heart disease is therefore very essential for preventing patients from more damage and saving their lives. Do you have any recommendations as to when a person should consider taking tests and which tests are recommended?
Yeah, so there can be two aspects to this question. Like for instance, one aspect is the early detection aspect, wherein for which the patient awareness programs and early reporting of symptoms becomes very important. Like for which the programs like these will actually help in patient awareness and early detection of symptoms, because in many cases we observe that, as Dr. Girish sir was mentioning, there can be very subtle symptoms like easy fatigability and inability to perform exercises, or very mild symptoms like sudden weight gain or leg swelling. So these kind of symptoms may be very subtle, which might go unreported, or many times we observe that patients actually conceive this to be something like a age related symptom. So that is one aspect of it, wherein there is early detection and reporting of symptoms to the doctor, and once they report to the doctor, then definitely there are investigations like an ECG, a heart echo scan, and then there are X-ray and certain blood tests by which the diagnosis of heart failure can become conclusive. Then there is second aspect of it is the prevention. When you talk about prevention, there are two levels. Like for instance, the first level is a person who is absolutely normal. He is not a diabetic, not a hypertensive, no other risk factors for heart disease. So this is what we call as the primordial prevention, wherein this person is advised to maintain a healthy lifestyle and to undergo annual general health checkups annually, by which he is able to prevent the risk factors of heart failure. That is, he is able to prevent the onset of diabetes or the onset of hypertension and other risk factors for heart failure. Then there is a second level of prevention, wherein we talk about a person who is already diagnosed with hypertension, diabetes, or with heart disease. So in this case, we know that he is already much more nearer at risk of heart failure. So for such patients, a dedicated cardiac checkup and dedicated cardiac follow-up is advised, wherein he is advised to meet a physician or a cardiologist who undertakes certain cardiac tests, like for instance an annual echo scan and functional capacity test, and by which he is able to assess the functional capacity of the patient and detect heart failure. So I think this together, the prevention and the early diagnosis, this kind of sums up the overall way of prevention of heart failure.
All right, Dr. Arava, the incidence of sudden cardiac death is on the rise, and in what ways can heart failure lead to sudden cardiac death?
Heart failure is the most common cause for sudden cardiac death. Due to heart failure, several neurohormonal changes and electrical changes occur in the heart muscle that leads to increased potential to develop lethal cardiac arrhythmias. There are two types of arrhythmias are there. One is tachyarrhythmias, another is bradyarrhythmias. In tachyarrhythmias, particularly is ventricular tachycardia and ventricular fibrillation. Heart rate is going up to about 200. In these high heart rates, heart was unable to pump the blood to the systemic circulation, and this should be treated immediately. And coming to the bradyarrhythmias, heart rate will come down and heart blocks will occur. This leads to the sudden cardiac death. In patients, those with high risk of sudden cardiac death and those patients who already survived from a cardiac arrest, better to keep the patients on intracardiac defibrillator to prevent further cardiac arrest and increase the lifespan.
All right, well, we'll slip into a short break now, but return with more questions for the doctors. Do stay with us. Welcome back. We're talking about heart health and what you can do in case someone near you is suffering from cardiac arrest. And an important thing for all of us to learn is CPR. Dr. Navasundi, cardiopulmonary resuscitation is a life-saving technique and the first aid that's required during a sudden cardiac arrest. What exactly happens during CPR?
I think, as you appropriately coined it, it is cardiopulmonary resuscitation. When we call cardiac arrest, it is an electrical activity where heart stops pumping, or it is pumping too rapidly that it's unable to pump the blood out. So at that time, we need to mechanically create pressure inside the chest and compress and decompress the chest in a manner that artificial increase in the pressure and deflating the chest keeps pumping the blood continuously when heart is not pumping, but because we are compressing the chest, it increases the pressure inside the chest and makes the person's circulatory system going and keep supplying the oxygen to rest of the body, mostly importantly to the brain. So this requires for any person to place two hands on the lower 1/3 of the breastbone and keep pumping rapidly about 100 to 120 times in a minute with compression depth of about 1/3 of the thickness of the chest, about 5 centimeters. Do not interrupt, constantly keep going till one gets the someone until becomes awake or qualified medical help arrives. This CPR is of two kinds. One, delivered by professionals such as doctors, nurses, or emergency technicians, or the second one called bystanders only, who are never trained. So in the trained CPR, we have both chest compressions and also mouth-to-mouth breathing. Here we give about 30 chest compressions and then give 2 mouth-to-mouth breath. But for those who are not trained to give CPR, they can just keep on doing the chest compressions till a medical help arrives. As I said, the cardiac arrest is an electrical abnormality, so it needs an electrical stabilization. If it has stopped, then you need to compress till it restarts. On the contrary, if it's beating too rapidly, more than 250 to 350 times in a minute, where it's just quivering, not able to pump the blood out, you need to deliver an electrical shock, what we call defibrillation. Today, my request is the single most important skill that anybody has to acquire from their school days to even those who are octogenarians is to do a CPR, because that can save a life. So please volunteer, whether there is an afflicted person in the family or not. It is the minimum skill that one must have to preserve lives around.
All right. Dr. Patil, it is said that no matter if a person is unconscious, you should continue to perform CPR. Is this true? And when should one not perform CPR?
Yeah, so that's a good question, because especially if, as Dr. Girish sir was mentioning, for a bystander CPR, to understand the question and the answer for this, we need to understand the basic stepwise approach for a CPR. Like, firstly, on seeing any person unresponsive, what do? Firstly, we call for help, like for an ambulance. That is the first step. Second step, we assess the response of the patient by calling out to the patient or patting the patient physically. So you assess the response. So even then, if there is no response, then you try to palpate or feel any of the pulses of the neck or the hand. Sometimes it can be difficult for a non-medico to feel the pulses, but we should not spend more than 5 to 10 seconds trying to feel this pulse. So you try to feel this pulse for 5 to 10 seconds. And all throughout these steps, you just keep observing the patient. If the patient is unconscious but still breathing normally, so if the patient is breathing normally, then do not do CPR, because a normal breathing implies that the heart pumping is actually happening sufficiently. But at the same time, there is one instance, like for example, a person may be having gasping or a air hunger, which is irregular air hunger kind of breathing, which is irregular gasping of breath. So that does not mean he is breathing normally. So in such cases, you go ahead with feeling of the pulses, and if you are not feeling any of the pulse in the neck or the hand, then go ahead with the chest compressions and mouth-to-mouth breathing and continue the CPR for at least 20 to 40 minutes or till the medical help arrives.
All right, Dr. Rava, we've been talking about creating awareness about CPR and its importance. If you can tell us, how important is it that people whose relatives suffer from heart disease learn CPR?
Any process that brings back the heartbeat within first minute is very important. That CPR is the only way that is very effective to bring back the heartbeat. And they should have a CPR training at schools and colleges and even at community level. so that the patients of high risk family members, they can know this, how to do CPR. Whenever there is emergency medical assistance during the times of cardiac arrest, they can use CPR and save your life. And CPR should be done properly, and effective CPR it should be very important to bring back the life. And CPR, we should make a concerned affected to make CPR CPR training must in the society.
Right. Dr. Navasundi, what are the stages of heart failure, if you could tell us?
Right. There are different stages on the basis of the vulnerability, their quality of life, their treatment opportunities. One depending on the disease status, the other one on the functional capacity of the person. We stage the disease as stage A, stage B, stage C and stage D depending on worsening heart failure status. Stage A is the mildest, stage D is the worst. And then you call them functionally NYHA class 1, class 2, class 3, class 4 depending on their exercise capability. People with more advanced disease can improve in their exercise capacity or worsen while the disease status is the same. That is why we have to have some objective metrics. So those people who have risk factor for future heart disease but have no structural abnormality in the heart and no symptoms are called stage A. Stage B is those who have structural abnormality but no symptoms, such as they have got a thickened heart muscle or who have already sustained a heart attack but absolutely no symptoms. They are called stage B. Stage C is those who already have structural abnormality in the heart and also have symptoms of tiredness, breathlessness or chest pain. Stage D is very advanced where even at rest there is a refractory heart failure where nothing much can be done. That in the severity, this is how you classify them, A, B, C, D. But functionally, if somebody is able to do everything without any limitation of activity, then they're called class 1. If they're able to do the same work with mild discomfort, then we call stage 2. If people are unable to do routine activities such as making their bed, taking bath, minimal activities, then class 3. And those who are really uncomfortable at all times are called NYHA class 4. This staging is very, very crucial because as a person moves from A to B or B to D, the prognosis means their outcomes are going to become worse. There are going to be repeated hospitalizations. So that's why it's important for people to be diagnosed and given stages so they're aware of their seriousness and then adhere to their treatment. The most common cause for hospitalization is non-adherence to the treatment.
All right. Well, thank you so much, doctors, for taking out your time and talking to us about this very important issue and the need to create awareness about what one can do and about heart health as well as CPR. Thank you all for watching at home. Goodbye.
Thank you.